Fosamax Tablets is used to prevent and treat certain types of bone loss, osteoporosis in adults. Osteoporosis causes bones to become thin and break more easily. Your chance of developing osteoporosis increases as you age, after menopause, or if you are taking corticosteroid medication such as prednisone for a long time. This medication works by slowing bone loss. This effect helps maintain strong bones and reduce the risk of broken bones, fractures. Active ingredient alendronate. Alendronate belongs to a class of drugs called bisphosphonates. How to use. Take Fosamax at least 30 minutes before eating or drinking any food or beverages other than water or taking any other medications including calcium, antacids or vitamins. Take Fosamax with a full glass of water and remain upright for at least 30 minutes. Do not lie down. Do not substitute water with mineral water, coffee, soda, juice or tea. Never take Fosamax at bedtime. Take Fosamax exactly as directed by a doctor. Do not increase or decrease the dosage without a doctor's advice. Take one Fosamax tablet once a day, every day. It is important that you keep taking Fosamax for as long as your doctor says to take it. For Fosamax to continue to work, you need to keep taking it. If you miss a dose, do not take it late in the day. Continue your usual schedule of one tablet once a day, the next morning. Contraindications. Because of how Fosamax works and how it is metabolized by the body, certain people should not take the drug. The drug is known to cause irritation to the gastrointestinal lining and may worsen underlying diseases, including Barrett's esophagus, dysphagia, and gastritis. Doctors should be cautious when prescribing the medication to patients with pre-existing conditions. Fosamax and Fosamax Plus D are not approved for use in children. People with the following conditions should not use Fosamax. People with abnormalities or problems related to the esophagus. People who cannot sit upright or stand for at least 30 minutes. People with hypocalcemia, low calcium in the blood. People allergic to ingredients in Fosamax or Fosamax Plus D. Precautions. Avoid taking any other medicines for at least 30 minutes after taking Fosamax. This includes vitamins, calcium, and antacids. Some medicines can make it harder for your body to absorb alendronate. Avoid smoking or try to quit. Smoking can reduce your bone mineral density, making fractures more likely. Avoid drinking large amounts of alcohol. Heavy drinking can also cause bone loss. Side effects. Get emergency medical help if you have signs of an allergic reaction to Fosamax, hives, wheezing, difficulty breathing, swelling of your face, lips, tongue, or throat. Stop using Fosamax and call a doctor at once if you have chest pain, new or worsening heartburn, difficulty or pain when swallowing, pain or burning under the ribs or on the back, severe heartburn, burning pain in your upper stomach, or coughing or blood, new or unusual pain in the thigh, hip, or groin, jaw pain, numbness or swelling, severe joint, bone or muscle pain, or signs of low calcium levels, muscle spasms or contractions, numbness or tingly feeling around your mouth or your fingers and toes. Common Fosamax side effects may include heartburn, upper stomach pain, nausea, diarrhea, constipation or headaches, or bone pain, muscle or joint pain.